classifications of drugs and their effects on the central nervous system. So as I have mentioned in the first part, we have depressants, stimulants, and hallucinogens. First is depressants. So as you can see from the picture, this is obviously the effects of depressants when you took this kind of substances. Okay, so depressants are also known as downers or central depressant. Okay, so this is a drug or endogenous compound that lowers or depresses arousal levels and reduces our excitability. That is the reason why it is called as downers, because they lower the level of arousal when they are being taken. So this is actually widely used throughout the world as a prescription medicine and as an illicit substance. Okay, so if you're gonna take this kind of substances, you should expect the effect. Okay, which might include pain relief, sedation, cognitive or impairment. Okay, even euphoria, muscle relaxation, lowered blood pressure or heart rate, respiratory depression and anticonvulsant effects, and even complete anesthesia or death at high doses. So sometimes these are being used as prescription medication, but other people are abusing this. Okay, so it could be medicinally used to relieve some symptoms of anxiety and insomnia. Okay, so they're also used recreationally for the following purposes, like for example, boosting your mood or inducing euphoria or to lighten up your mood. Okay, so it can also reduce social anxiety and even improve sociability or social interaction with other people. Now, we have different kinds of depressants. We have ethanol, alcohol, barbiturates, and benzodiazepines. Okay, for ethanol, it suppresses the activity of the mind and the body. Okay, the barbiturates is actually prescribed for medication of anxiety and insomnia, while the benzodiazepines is having a tranquilizing effect, which is actually used and prescribed to those people who are having anxiety. Okay, so next we have gamma hydroxybutyrate. So this is another kind of depressant. This is in form of odorless and tasteless, and sometimes this is used illegally and associated with some sexual assault. Like they're going to give this to the victims, okay, and there might be a sexual assault that might happen if being used in a wrong way. Then we have marijuana and inhalants. So marijuana is legalized in other states, but here in the Philippines, this is not legal. Okay, although there are some instances wherein it is used for medication as a minor hallucinogen. But other people are abusing the use of marijuana. Okay, so other slang terms include booze, downers, forget-me pills, roofies, and yellow jackets. Alright, then we have stimulants. So most of the stimulants are being used this way, as you can see. Stimulants are the opposite of the downers, so they are the uppers. Okay, so they are also known as the psychostimulants, wherein it might induce temporary improvement in either mental or physical functions or both. Okay, so it might have this kind of positive implication, but actually most of the effects might include enhanced alertness, wakefulness, and locomotion, among others. So due to their effects, typically they have an up quality to them. That's the reason why they are also known as the uppers. Okay. So there are different effects of stimulants, as I have mentioned earlier. Okay, so it increases arousal, it can increase your heart rate and blood pressure. Okay, and this is why other people like it, is the perception of diminished requirement for food and sleep. Okay, so many stimulants are also capable of improving mood and relieving anxiety, and some can even induce feelings of euphoria. Okay, So what are the medical uses? So there are medical uses actually, but some people are abusing it, as I have said earlier. Okay, so it can counteract lethargy and fatigue throughout the day while at work. Okay, while doing other activities. That's why those people who are staying at the graveyard shift for their work, some of them, I'm not actually referring to all, okay, or to general, but some of them might use this kind of stimulants for them to stay awake for a very long time. Okay, it also reduces sleepiness and keep the person awake when necessary, as well as to treat narcolepsy. So we have discussed narcolepsy last meeting or in the other topic. So this is hypersomnia or excessive sleeping. It also decreases appetite and promote weight loss, as well as to treat obesity. Okay, and also it can improve concentration and focus to those people who are having attention deficit hyperactivity disorder. Okay, and then occasionally it is used to treat clinical depression, more particularly non-typical depression and treatment resistant depression. Okay, so we have different types of stimulants. We have amphetamines, ephedrine, and caffeine. Okay, so amphetamines are also prescribed for people with ADD. Ephedrine lowers blood pressure and it is a nasal congestion treatment. And caffeine stimulates the body's central nervous system to make muscles relax. So even caffeine is a kind of stimulant, and you should also limit yourself or watch yourself as you're taking coffee because you might have reached your limitation. Okay, nicotine. So for cigars and cigarettes, tobacco. Okay, so this is addictive. It can increase your heart rate and blood pressure. Okay, then we have methamphetamines. So this kind of substance appear in powder or crystal form. Okay, so you can dissolve in alcohol or water before it could be injected into your bloodstream. And then we have cocaine. As you can see in the first picture for the stimulant, so usually this is being snorted, or in other ways, they dissolve it in water to inject in the body. Alright, so I'm going to discuss the next part on the third part of our